So please join me in welcoming our host this afternoon, Senator Chris Dodd.
Well, first of all, thank you, Kevin, and most of all, thank all of you. When we organized these meetings, the first one we had in Hartford about 2 weeks ago at 8:30 on a Monday morning, my anticipation was that about 100 people might show up. Walked into the room and 700 people showed up to talk about the issue of health care. And today, I didn't know what the audience would turn out to be, but I'm delighted to see as many people come up and show up this afternoon to talk about this issue, how critically important it is. I want to thank Chris Murphy, the congressman in this district as well, who now sits on the subcommittee dealing with health issues, and the Commerce Committee will be directly involved as part of our congressional delegation in grappling with this issue as well. I report to you here, obviously, the news over the last week on a number of issues. Tom Daschle, who was going to be the Secretary of Health and Human Services, now will have that position. And so the question is, who will assume that responsibility in the cabinet? Sets us back a bit. The chairman of the Health, Education, Labor Committee, the senator to the north of us here, Senator Kennedy, is obviously struggling with his own health issues. I spoke to him about an hour ago. He's still obviously recuperating from a very serious operation last summer with brain cancer. But his hope is to get back and be engaged in the subject matter as well. So obviously we're not beginning with as strong a field as we had hoped to come to terms with this issue, which has defied national solution for at least 60 years. It was 1948 when a proposal was made to have a universal health care system put in place. And nothing, of course, over the years has really contributed to it except increasing costs. We spend $2 trillion a year of our money on health care. It's a staggering amount of money. 47 million of our fellow citizens have no health care at all, and those who do have watched their premiums skyrocket. Almost 42% in the last 6 or 7 years alone. So it is an issue that is absolutely essential. When you're consuming roughly 17% of the gross domestic product of our country, and every indication that number will continue rising, obviously this is a matter beyond the ethical or moral questions of whether or not we ought to, as a great and wealthy nation, be able to deal with health care. Obviously the economic implications are huge. And I'm obviously preaching to the choir in this room today or others across the country, as we watch 20,000 of our fellow citizens lose their jobs every day in this country. Between 9 and 10,000 every day are losing their homes. So that 47 million, those numbers are going to change as we watch more and more people over the coming weeks and months as a result of our economic crisis feel the tremendous pressures that occur in having their health care needs be met. So the issues are huge, they're complex. Today, obviously, we can talk about anything you'd like to talk about. We've tried to break the subject matter down into 3 areas, which is what we're trying to deal with it, get our arms around it as a national public debate. One is issue of cost, second is coverage, and third is prevention. Today, we'd like to talk a bit about prevention, although obviously I'll leave the questions to whatever your interest may be. But if we can start talking about how we can keep people away from getting sick in the first instance, then obviously we can reduce our costs and then seeing to it that people get the proper care once they do become ill. If we spend, we're told, roughly $10 per person a year on prevention, that is dealing with healthier lives, better food, more physical exercise in our schools and the like, you can save as much as $16 billion a year, each year, over the coming years, just by reducing the kind of problems and exposures that people go through as a result of things that we ought to be doing, healthier lifestyles in our nation. And I discovered that we have less than 6% of our middle schools in this country have any kind of required physical exercise. Less than 8% in our high schools across the country today. Obviously a lot of pressures on schools in terms of costs and things they face. Fewer and fewer children even walk to school any longer because of legitimate fears parents have about wandering the streets even a few blocks away where a school may be. The availability of junk food and vending machines in schools. Obesity has become the largest single problem in many ways that a generation is facing. An obese child is not merely a problem for that child at that age, but the chronic illnesses that develop as a result of obesity will raise serious issues in the future and longer years. So that issue alone, of just how we try to grapple with that, is of critical importance. Anyway, the point today is to share a few thoughts here from those of us up here, and then to turn this over to you. We're going to begin this debate in the next few weeks. Obviously, we're grappling right now with the stimulus bill until 1 o'clock in the morning last night in the United States Senate, back at it again tomorrow, today in fact, and Tuesday, trying to come to some terms around that particular proposal. And then there will be some financial regulation, which is going to be a major debate, and healthcare comes very quickly. My hope would be, and obviously these hopes have been raised in the past, that we would be able to deal with a healthcare plan in this country this year. The reason I think there may be a greater chance for this is not because of good news. In fact, it's because of the bad news. And in fact, we may be willing as a country for the first time to set aside some of these differences and come around a proposal here that will allow us to move forward. That's not necessarily welcome considering the bad news we're facing. But it's at moments like this sometimes that you can get things done that you can't get done in relatively normal times, if you will. People willing to sit down and hammer out differences to put together proposals that will allow us to once and for all to come to terms with this issue. Not that it's going to dramatically change overnight all of a sudden, but that over a period of time we can see to it that no one in this country would have to go without health care, that we can bring down costs, that we can also deal with the kinds of problems that people face every day as a result of not being able to deal with it. Now, I haven't covered all the subject matter, obviously, here. There's an awful lot to talk about. We're not going to exhaust the subject matter this afternoon either. And I'd invite those of you here who maybe not get a chance to raise a question or a point of view to our panelists or others to let us know, either Chris, through his website, or ours, or others that you think will be willing to listen to your ideas and thoughts as to how we grapple with this. But it's obviously of national significance and importance, ethically, morally, from a health reason, as well as economic reasons as well. So again, I thank all of you for coming out and taking valuable time on a Saturday to be here, to engage in this conversation and discussion that will allow us hopefully to move forward on this subject matter. With that, let me introduce the congressman of this district, Chris Murphy, who is in a very critical and important position.